Good afternoon. Our names are Robert Attard, Erica Zafra, Emma Graham and Nadia Gabawi. Today we will be talking to the class about Indigenous Australians living in urban New South Wales, whilst discussing the disparity in health status and life expectancy, using diabetes as a key example to emphasise health inequality. We would also like to pay our respects to the Aboriginal people, both past and present, acknowledging them as the original owners of the land we stand on. We kindly warn that our presentation may contain names or images of Indigenous Australians who may be deceased. Table of Contents. Slide 1, Title and Acknowledgement. Slide 2, Table of Contents. Slide 3, Urban Definition. Slide 4, Population of Aboriginal people and the percentage living in urban regions. Slide 5, The gap and the social determinants of health. Slide 6, Diabetes mellitus and the percentage of Indigenous diabetic Australians. Slide 7, Primary prevention, health promotion and government funding. Slide 8, Diet and exercise. Slide 9, Culture and health. Slide 10, Nursing standards and code of conduct. Slide 11, a video to conclude. Slide 12, our solution. Slide 13, references. Urban definition. According to Society and Society 2018, urban can be defined as a region encompassed by a city. It does not promote any agricultural jobs. Urban consists highly of commercial buildings, high-rises, roads, buildings and railways. Town, cities and suburbs are also known as urban areas or metropolitan cities. Population of Aboriginal people and the percentage living in urban regions. The Australian Bureau of Statistics 2017 estimates that the entire Australian population is currently 24,865,330 people, where 649,200 people identify as Aboriginal or as Torres Strait Islander. The breakdown percentages according to the Australian Bureau of Statistics 2017 are as follows. 91% are Aboriginal origin, 5% are Torres Strait Islander, and 4.1% are both Aboriginal and Torres Strait Islander. The census published by the Australian Bureau of Statistics 2017 revealed that the Northern Territory has the largest overall percentage of Indigenous people in comparison to non-Indigenous Australians. However, New South Wales contains the largest number of Aboriginal and Torres Strait Islander people. Large birth rates in Indigenous populations contribute to a larger number of young adults than in non-Indigenous Australians. Australian Bureau of Statistics 2017. According to the New South Wales Health 2018, the government website has published that 220 health-related services are available across New South Wales. The Australian Institute of Health and Welfare, as cited in WARE 2013, contrasts the percentage of medical practitioners practicing in major cities and outer regional New South Wales, and the 52% difference emphasises the difference in availability, accessibility and affordability. Stoneman and Taylor, as cited in WARE 2013, state that the majority of Indigenous Australians reside in urban cities rather than rural areas. Interestingly, remote and urban health services have an inequitable expenditure division. The Australian Institute of Health and Welfare, as cited in WARE 2013, have found that 4 in 10 Indigenous focused services can be found in rural areas. If one were to compare rural and urban populations by using the census provided in the Australian Bureau of Statistics 2017, one may see that 79% of Indigenous Australians live in urban cities. The Steering Committee for the Review of Government Service Provision, as cited in WARE 2013, using their quantitative study, have found that most Indigenous Australians utilise non-Indigenous specific services, this mostly being via the public sector. The gap and the social determinants of health. The Australian Human Rights Commission 2018 defines Closing the Gap as a government-funded program that proposes to decrease disparity among Aboriginal and Torres Strait Islander people regarding life expectancy, child mortality, access to early childhood education, educational achievement, and employment outcomes. The Social Justice Report, cited in Derivan, Francis and Anderson 2018, states that the gap is not simply referring to health inequality, but also how the social determinants of health are disproportionate among the two social groups. According to Derivan et al. 2018, the government involved tackling several issues that Indigenous Australians face and where a large contrast separates Indigenous people from non-Indigenous Australians. The target date for life expectancy, according to the Australian government, cited in Derivan et al. 2018, has been altered to 2031, where in the original agreement, within a generation, was in compliance. In 2014, the Australian government, cited in Derivan et al. 2018, revealed that Indigenous Australians have a lower life expectancy of 9.5 years for females and 10.6 years for males in comparison to non-Indigenous Australians. Mortality rates in Indigenous Australian children have reduced by 33% since 1998, Australian government, as cited in Derivan et al. 2018. Council of Australian Governments, cited in Derivan et al. 2018, outlines the importance of early childhood education and the government's agreement to ensure all children under 5 have access and are enrolled for school. The 2013 census confirmed that 85% of Indigenous children were enrolled to attend school. The Commonwealth of Australia, cited in Derivan et al. 2018, reported a 20% positive improvement in literacy and numeracy skills for Indigenous children between 2010 and 2016. Merely 38% of rural Indigenous children, according to the Commonwealth of Australia, cited in Derivan et al. 2018, are meeting median literacy and numeracy levels. The Australian government, cited in Derivan et al. 2018, published a 20% reduction in the gap between Indigenous students reaching Year 12. The connection with education and employment was made, where Derivan et al. 2018 states that those who are more educated generally have the potential to obtain higher paid occupations. According to the Commonwealth of Australia, cited in Derivan et al. 2018, Indigenous Australians are also twice as likely to be unemployed than non-Indigenous Australians. One health issue that Indigenous Australians commonly face is diabetes mellitus. Diabetes mellitus and the percentage of Indigenous diabetic Australians. Australian Indigenous Health Infonet 2018 defines diabetes as a result of the body becoming unable to adequately produce insulin naturally. Diabetes mellitus encompasses two main types of the disease. Type 1, or insulin-dependent diabetes mellitus, IDDM, is when the pancreas does not produce insulin due to non-environmental factors such as biology. Type 2, similarly, is due to the pancreatic dysfunction, however, can be managed by diet, lifestyle, and in some cases, insulin injection. Diabetes New South Wales and ACT 2017. Burrow and Ride 2016 retell the history of European settlement invasion in Australia. Aboriginal and Torres Strait Islander people began to lose their natural lifestyle of hunting and gathering food as the years progressed. Traditional, spiritual, cultural practices began to change. It was due to these changes where physical activities and nutrition became a key role towards developing diabetes. Prior to the European settlers arriving to Australia, Aboriginal and Torres Strait Islanders were deemed fit, lean and healthy and did not suffer from metabolic conditions. Burrow and Ride 2016. The first detailed study of investigations of diabetes within Aboriginal and Torres Strait Islanders were first reported in the early 1960s. The studies found a significant correspondence with the westernised lifestyle and level of diabetes within Aboriginal and Torres Strait Islander people. The Australian Institute of Health and Welfare, cited in Burrow and Ride 2016, provides statistics that show Indigenous Australians are 3 times more likely to acquire diabetes than non-Indigenous Australians. Gestational diabetes mellitus is twice as common in Aboriginal and Torres Strait Islander women. Indigenous people are 4 times more likely to be hospitalised for diabetes. Diabetes was the second leading cause of death amongst Aboriginal and Torres Strait Islander people, which is 6 times the rate in comparison to the non-Indigenous population.
7. Primary prevention, health promotion, and government funding. The World Health Organization, cited in the Australian Government Department of the Prime Minister and Cabinet 2014, includes in the Aboriginal and Torres Strait Islander Health Performance Framework Report the definition of health promotion, which is the technique that helps patients gain knowledge and with that autonomy about their health and the social determinants involved. The New South Wales Ministry of Health 2016 includes a primary prevention description using health promotion as a clear example. Primary prevention, according to the New South Wales Ministry of Health 2016, includes healthy eating, exercise programs, and education. Primary prevention is all about ensuring the disease does not occur in the first place. Forming healthy habits from an early age is imperative in fighting diseases like our chosen example, diabetes. Secondary prevention relates to managing the disease and any associated risks that go along with it. New South Wales Ministry of Health 2016. A 2013 study in the Australian Government Department of the Prime Minister and Cabinet 2014 revealed that Indigenous teenagers were less likely to discuss health or psychosocial issues with a health professional. In nearly every primary healthcare facility, health promotion is offered in some way. However, Indigenous Australians are still not utilising the services available. Australian Government Department of the Prime Minister and Cabinet 2014. Mercer, cited in the Australian Government Department of the Prime Minister and Cabinet 2014, expresses that evidence is still unclear as to how much difference health promotion can make in long-term behavioural issues. Malseed, cited in the Australian Government Department of the Prime Minister and Cabinet 2014, in a study on Indigenous teenagers found behaviour did not change, however found strong evidence to suggest that the information was retained and passed on to the next generation. If the objective of health promotion is to appeal to an audience, the question remains, is health promotion appealing correctly to Indigenous Australians? According to Black, cited in the Australian Government Department of the Prime Minister and Cabinet 2014, when promoting health with Indigenous people, one must understand difference, include the community, have Aboriginal Australian health workers when possible, and support culture. New South Wales Health 2018 reports on one of those government-funded services, the Aboriginal Health Unit. This service is available in the Western Sydney region in an effort to improve Indigenous health and wellbeing. Services include medical treatment, education links, mental health, drugs and alcohol services, social services, and Aboriginal health promotion. New South Wales Health 2018. 8. Diet and exercise. Fallon and Eddings 2018 state that the Aboriginal and Torres Strait Islander people once had a rich diet of flora and fauna that were native to the land on which they lived on. This could range from land animals such as kangaroo, emu, and echidna, to sea animals such as fish and shellfish, to birds from the sky. There was a great abundance of meat and vegetation, along with bush herbs and spices available to the local people, that illnesses such as diabetes was unheard of, as all of the food that was consumed was natural, healthy, and free of chemicals and additives. Fallon and Eddings 2018. There was also a greater need for people to do more physical activity, as a large portion of their day consisted of hunting and gathering for the people of that tribe. There were no cigarettes, alcohol, or drugs, and thus traditional Aboriginals were healthier than their ancestors today. Fallon and Eddings 2018. When European settlers or invaders introduced sugar, flour, and tobacco, this led to an increased risk of diabetes and cardiovascular diseases, which had not been seen amongst people beforehand. Fallon and Eddings 2018. The Victorian State Government 2015 has published on their government website information about Aboriginal people and daily activity. Aboriginal people may not view exercise the same way Westerners might, as Aboriginal and Torres Strait Islander people believe in a community way of living. It may be seen as disrespectful or selfish for one person to look after himself in the way of doing physical exercise. The Victorian State Government 2015. This is where it may be conflicting for some Aboriginal people, as they may want to improve their health and physical fitness, but may not know how to do it so everyone can be included. The Victorian State Government 2015. Group fitness classes are a great initiative that are being undertaken by some communities so that everyone can participate and no one is excluded. benefiting the whole community. 9. Culture and health. Corf 2018 states that Aboriginal culture plays a major role in health. It is not merely determined by physical well-being, but importantly, spiritual. Indigenous Australians perceive health far more holistically than non-Indigenous Australians, Corf 2018. A prime example, according to Corf 2018, says that Indigenous women traditionally did not have hospitals to go to during childbirth, or even have doctors to help deliver their babies. They would generally go into labour with only one other woman from their community to assist. This is the reason why many Indigenous women today are reluctant to go to hospitals to give birth, or when they are sick in general, especially if it means they will be treated by male doctors or nurses, Corf 2018. Corf 2018 explains that culturally, women and men must be seen by doctors and nurses of the same sex as themselves, as this would bring immense shame otherwise. It would also be beneficial for staff in healthcare facilities to have an understanding of Indigenous culture, so that they know how to communicate in a way that is non-threatening and will make non-Indigenous Australians feel comfortable enough to seek assistance when required. 10. Nursing Standards and Code of Conduct. The Nursing and Midwifery Board of Australia 2016, in the Registered Nurse Standards for Practice document, outlines 7 core standards to ensure safe and competent care. In reference to Standard 2, engaging in therapeutic and professional relationships, nurses should maintain a high level of professionalism at all times and be flexible to every patient need. The Nursing and Midwifery Board of Australia 2016. The second standard outlines the importance of being culturally sensitive and respect every unique difference, so each patient-nurse relationship can flourish. The Nursing and Midwifery Board of Australia 2016. This standard can be applied to an Indigenous Australian context, where as nurses we must ensure that we respect, understand and treat each Indigenous Australian person with patient-centred care and cultural sensitivity. If one may make reference to the Code of Professional Conduct for Nurses in Australia, in reference to Code 4, nurses respect the dignity, culture, ethnicity, values and beliefs of people receiving care and treatment, and of their colleagues, similarly, the care nurses provide must be in accordance to the Code of Conduct, the Nursing and Midwifery Board of Australia 2008. Our solution. To conclude, a solution may be hypothesized. Understanding Aboriginal Australian culture includes empathy, comprehension and acknowledgement. The way someone may become competent is by accepting and celebrating diversity. Cynically, we cannot judge or comprehend an Indigenous Australian patient or view them via Western eyes, but instead encourage, promote and accept well-being. The solution involves more Aboriginal-led initiatives and programs where Indigenous people take control of their own lives. Increasing Indigenous Australian involvement will ensure that health and autonomy are interlinked. By continuing to advocate education as a forerunner for success, more individuals will live healthy lifestyles, seek out medical attention when required, and obtain employment to ensure success. Equality is something difficult to reach, but it begins by breaking stigmas and ensuring resources are shared according to need rather than equal distributions. To summarize, the disparity in health status and life expectancy can be lessened by focus on primary prevention methods, increasing education, equitable distribution of resources, government funding, and making all services accessible, affordable, and accommodating to all Australians individually. 13. References. On the next couple slides, you can see all the references we have used to create our presentation.